Hello and welcome to the first ISET Foundation SystemTalk podcast. My name is Gitta Peyn. I'm a German systems and cybernetics researcher who has focused on language development and analysis and emulation of communication and conflict dynamics. I have strong collaboration with ISET Foundation, and I am an advisory board member of ISET Foundation. In this episode, I will focus on the questions of what distinguishes the coronavirus SARS-2-CoV from other common colds and respiratory infections, such as influenza, and why it is therefore necessary to practice social or physical distancing. The coronavirus SARS-2-CoV was first discovered in China. The German research team, led by virologist Christian Drosten of Charité Berlin, Germany, was asked to study it, and the team subsequently developed a test that was reviewed and accepted by 4 other renowned research institutions. What everyone should know about the coronavirus, I want to focus on 5 points so that doubts can be dispelled as to whether social distancing is really necessary or not. The first point concerns the incidence of infection of SARS-2-CoV. We are used to an infection rate of 1.3 or 1.4 people per infected person per contact round from influenza viruses. This means if you have been infected with the influenza virus, you will infect 1.3 to 1.4 other people on first contact with other people. Each of them and you will infect another 1.3 to 1.4 people in the second round, who in turn will infect another 1.3 to 1.4 people, and so on. If we calculate this with a total of 10 rounds and assume a factor of 1.3, we come up with about 14 people that you will have infected by then. So much for influenza. The coronavirus, on the other hand, comes with an infection rate of 3. That doesn't sound like much more at first, but now something else comes into play that we call exponential growth. In the first round, you infect 3 people. In the second, you infect 9. In the third, 27. If we do that 10 times in total, we come up with the amazing number of 59,000 people you have infected. Now the first wave on infection here in Germany has just begun. We reacted quickly and recommended social distancing nationwide, and then also enforced it by the government. This way, we were able to reduce the infection rate significantly. In Italy, the measures were taken too late. The results are devastating. So let me come to my second point: overloading and exhausting the health system. Here in Germany, we have one of the best health systems in the world. Our hospitals are very well equipped. Nevertheless, we are not prepared for the coronavirus either. We do not have enough beds in the hospitals, and certainly not in the intensive care units, to treat all coronavirus sufferers at the same time if we do not get the infection rate down. This phenomenon is known as cause to call for flatten the curve. By reducing the speed of propagation through social distancing, we reduce the number of people who are so severely affected by coronavirus that they have to be hospitalized or even have to be admitted to intensive care for respiration. The more overloaded the health system becomes with the number of infected people, the fewer people can be treated sufficiently well and the more will die. That brings me to my third point. Who will suffer the most if we don't get the infection rate down? The coronavirus actually comes with mostly mild symptoms. Many people do not even notice that they are infected. 80% of those who are ill have some cough, a scratchy throat, maybe a fever, but they recover quickly. The remaining 20%, however, do not get off so well, and of these 20%, 5 are at risk of dying from the virus. Usually, this affects older people and people with pre-existing conditions, especially those with pre-existing respiratory conditions, which are more common in smog-polluted cities. People who already have a poor immune system due to poverty, malnutrition, bad air and other factors weakening the immune system are likely to become seriously ill. The higher the number of poor people in the population of a country, the higher the number of those who will become very or even seriously ill from coronavirus. Since the infection rate is exponential, we do not notice so much at first and can think, okay, it is probably not that bad after all, but we are wrong. The longer the virus rages, the more people get infected, until eventually the health system collapses because too many infected people flood the hospitals. And so I come to social distance, point 4. If you live in relative prosperity, have no pre-existing conditions, are not exposed to smog, and if you are under 50 years old, it is not very likely that you will develop very bad symptoms when the coronavirus hits you. There is a 70% probability that you will get it, but you will be fine. But because you will infect so many other people if you don't practice social distancing, you will be responsible for the fact that more and more elderly, immunocompromised and pre-diseased people will die because of you. The more people will be as irresponsible as you are by not practicing social distancing. In Italy, the death rate in some provinces is 10%. That means 10 out of 100 people who are ill die. The health system in Italy is not as good as that in Germany, and the Italians started social distancing very late in the progress of coronavirus. The price they pay for it is high. Now, the health system in India is even not as good as that in Italy. The first wave has only just begun, and we have to calculate with a second, even a third wave, which ordinarily are far more dangerous when happening in fall or winter, when the common flu has season. This brings me to point number 5. We don't have a cure for coronavirus yet. There is no drug to treat the symptoms efficiently, and there is no vaccine to provide herd immunity. All we have left are organizational means such as reducing the number of cases of infection to a level that the health system in question can cope with, hygiene and simple treatment in hospitals. We do not have anything like Tamiflu for influenza. It is not a question of whether you are infected, but of how many people you do not infect. We must relieve the burden on hospitals, and the only weapons we have for that at the moment are the following. First, thorough personal hygiene. Wash your hands several times a day for 20 to 30 seconds to ensure that you do not carry the coronavirus on them. Disinfect door handles and everything you touch after you have been outside. If you go shopping or have been outside, first wash your hands thoroughly, then pack your groceries or whatever you bought, then wash your hands again. Second, do not cough or sneeze at others or objects, but cough or sneeze into your handkerchief and then throw it away immediately, or cough into the crook of your arm. Third, wash clothes you have been outside with daily at least 60 degrees. Fourth, train your immune system and motivate those who are previously ill, immunocompromised and older people in your household and circle of friends to do the same. Lots of exercise in the fresh air, walking alone for example, nutritious food, sunlight with vitamin D and a good mood. Fifth, drink plenty and sufficient hot water and hot teas without sugar. Drinking at least 1.5, better 2 liters a day is important anyway. But now it is even more important because drinking a lot regularly flushes out the throat, and that's where the virus first will infect you before it spreads to the lungs. Sixth, if you are infected or live with infected people, go to quarantine for 14 days and wear a respirator so that you do not infect other members of the household. Seventh, consistently practice social distancing. Keep a distance of at least 1 meter to people from outside the household. Stay at home. Move your work to your home office as much as you can. Stay away from older and pre-sick people in particular, so that you do not infect them. Always remember, you may be sick even if you do not show any symptoms at all. Take care of the elderly and pre-sick in your family, but do it with a lot of hygiene and distance. When you do your shopping for them, disinfect what you have brought. Put it in front of the door so that they can take it in. Provide your family members with possibilities to talk to your elderly and sick via computer or phone. Practice physical distancing, but do not leave them alone with fear. Sing together, play online games, build online groups that the elderly and pre-sick can use. And most important, take care of poor and sick people accordingly. Form communities of solidarity. Donate food to the poor. The better the immune system of the individual and society, the lower the mortality rate. All these are measures to flatten the curve. The point is to have only so many people who are seriously ill over time that the health system can still provide them with good care. And there is one more thing. We need those people on which the system depends healthy. And these people aren't only doctors and nurses. Crises show us which persons are systemically relevant. This includes cashiers, greengrocers, the people from the garbage collection, the cleaning ladies, and many others. The more of them are infected, the sooner the system collapses, and then we not only have to deal with more sick people and death, but also with more and more intense social conflicts. Crises first motivate waves of solidarity. If they last longer, the pressure on individuals and organizations becomes greater and greater, increasing the likelihood of greater social unrest. And when this happens, fewer and fewer people will practice social distancing. The curve rises exponentially. Here's a few thoughts of what might happen next. The number of infected people will rise, and it will rise exponentially if measures to flatten the curve are not taken. So far, it doesn't look like the virus is gonna go away for the summer. If it does, we have a few months to breathe a sigh of relief. Time for our researchers to develop vaccines and medicines. But it is not very clear whether the virus will have less of an effect in summer. It doesn't look like it will. Either way, it will get worse again in autumn. It is also not clear whether we will then have medicines and vaccine. The good news is that the virus seems relatively stable against mutations, which makes research on a vaccine easier. Every country is now called upon to make its contributions so that the curve worldwide can be kept flat enough for hospitals and researchers to do their job. With any luck, we will find a vaccine by fall. If not, we can provide herd immunity in the long term through careful screening, which is only ever as high as the health system can cope with. That could take up to 2 years. We will have to get creative now and learn to live with the situation. This includes coming up with new ideas on how we can help each other. Poverty reduction plays a very important role here because, as I said, poor people have poorer immune systems and poor countries suffer the most from pandemics and other global crises. You make your contribution through social or physical distance and hygiene and helping the poor. If you want to do more, get in touch with your respective government. Found social communities and self-help groups and find systemic solutions. You help your economy by relaxedly searching the crisis for opportunities to earn money and create jobs. Good luck and thank you for your time. Don't forget to subscribe to our channel and share the podcast diligently among acquaintances, friends, colleagues and family members. Information is vital and crucial to the game. Help us become part of the international community flattening the curve for our elderlies, our sick and our poor to make it through coronavirus. Spread the word.